Welcome to Professor Gregory Lipp, who is one of our medical advisors and a world expert in atrial fibrillation. This is Series 1, Episode 6 on AF as easy as ABC. It's the last in our series, and so we are today focusing on AF and lifestyles. Thank you, Greg.
Thank you, Trudy. And this is the last episode, as mentioned, and we have been dealing with the management of atrial fibrillation, trying to have a streamlined and integrated holistic approach that can be pertinent to general practitioners, to non-cardiologists, and to cardiologists, and most important to the patient, that everyone involved in the atrial fibrillation patient journey or the patient cycle is speaking to the same principles of managing atrial fibrillation. And that need not be complicated. And we've been saying that it's as easy as A, B, and C, because A is avoid stroke, or A is anticoagulation. B is better symptom management with rate control or rhythm control to improve patient symptoms. In terms of C, that's the cardiovascular and comorbidity optimization. And this was discussed in our last episode, where we're focusing on risk factors and associated comorbidities. And as part of the C, we have to pay attention to the lifestyle type factors, as well as the patient psychological morbidity. And it's also important that to have shared decision making, because patient values and preferences are central, are so important when we're trying to have the goals of treatment and to ensure management and treatment adherence and persistence with therapies. So in terms of the lifestyle type changes, what can we discuss? Well, this is not in any particular order, but just to say that obesity and physical inactivity, this is certainly related to the development of atrial fibrillation. Excessive alcohol consumption and other stimulants, again, can be related to the development of new onset atrial fibrillation. Smoking cessation in relation to the overall cardiovascular risk profile of the patient. All these have to be addressed and discussed at the initial consultation with the patient with atrial fibrillation. Now, let's start off by talking about obesity. There's a relationship between obesity and the development of atrial fibrillation. And I think overall, you could say obesity links to overall cardiovascular health. And in the last episode, we discussed about the importance of addressing cardiovascular risk profile of our patients. And this discussion is with regard to obesity is part of that. Physical activity or physical inactivity rather, because I think there is a reasonable amount of evidence that at least improve physical activity, moderate physical activity is associated with better outcomes in patients with atrial fibrillation. One of our recent studies has shown that actually physical, a sedentary state, or in people who have been previously exercised and then stopping exercise, their outcomes are actually worse in patients with atrial fibrillation. So some degree of physical activity is very helpful. We're not talking about the subgroup of who are the endurance or enhanced athletes. That's a different story, but when it comes to discussing the risk of atrial fibrillation. But I'm talking about the general population, where at least ensuring physical activity, and at least moderate physical activity, is good. Alcohol, of course, leads to atrial fibrillation by a number of ways. So excessive alcohol, alcohol, you could actually crudely, and apologies for saying this, is a poison to the heart. So it can actually precipitate atrial fibrillation. And this relationship is well known because from decades ago, the so-called Friday night syndrome, where in fact very young patients with no other risk factors develop atrial fibrillation after excessive alcohol intake. But that can, of course, be linked to increasingly recognize some of the other stimulants on the heart or substance abuse and things like this. Now, Smoking is not necessarily a direct relationship to developing atrial fibrillation, but smoking and cardiovascular risk profile, of course, are well linked. And some of the observational data at least show that with stopping smoking or non-smokers, the potential of atrial fibrillation related complications is lowered. So these are the lifestyle type aspects of atrial fibrillation management. But it's also important to recognize there is a psychological morbidity associated with atrial fibrillation. We've published ourselves from a study on anxiety and also depression in patients who particularly have problematic atrial fibrillation. And if at the initial evaluation or consultation in clinic, it's important to ask about these things. What we do in our atrial fibrillation clinic is, again, the patient engagement, the discussion and almost counseling of the patient, explaining the condition, especially in the first diagnosed patient with atrial fibrillation, the shared decision making in regard to decisions, particularly, for example, anticoagulation for stroke prevention, as well as decisions about rate control, heart rate control, or rhythm control that we covered in previous episodes. And of course, in a sense, a agreed joint decision making with regard to managing the management plan. And with the patient involvement, we like to think our atrial fibrillation clinic it champions the shared decision making that we do think is helpful from the patient perspective.
Thank you. It's so important that people understand some of the risk factors, understand the lifestyles, so that they can help to hopefully improve their health and atrial fibrillation. And I think the key message is there, like with most things, it's about exercise, diet, substance abuse, alcohol abuse. And I think when we use the word abuse, we imagine, excessive, but it's not always just the quantity that you may drink, it is also the regularity of drinking those amounts. So I think it's really important for the viewers to, like anything in life, do things in moderation. I would like to thank you. It's been an excellent 6-part series, and we very much hope that we can go on to produce series 2 with you and invite some of your colleagues as well, and perhaps explore in more detail. We've talked about anticoagulation in detail, anticoagulation as a therapy to reduce your risk of AF-related stroke, but it doesn't actually treat the symptoms for those that experience symptoms. I'm sure we will be exploring in series 2 the various treatment options, from rhythm control, rate control, drugs, cardioversion, ablation, etc., and go into a lot more detail. So for now, Professor Lipp, thank you so much for your time and your expertise. And we're so grateful that you're a medical advisor for AF Association and for helping us to deliver this education to patients worldwide. Thank you.
Thank you very much, truly. Most delighted. Thank you.